Hello, I'm Caroline, one of the PAs here at Family First Primary Care.
And I'm Scotty, the nurse practitioner here.
And we're here to talk to you today about colon cancer screening.
Yeah, so colon cancer screening is super important for all people over the age of 50, although those recommendations may be changing soon to maybe even 45.
And there are several different ways that you can get yourself screened for colon cancer. The first of which is just a fecal stool card, which checks for blood in the stool. And that can be done every year and is the least invasive of our options.
Another option is the kind of standard colonoscopy, which is every 5 to 10 years based on the guidelines after your colonoscopy.
And then there's also a newer version called the virtual colonoscopy or a CT colonography, which basically is just an imaging study looking for any abnormalities in the GI tract.
And the other option is the stool DNA sample, like the Cologuard.
Okay, so breaking into this thing. All right. So in every Cologuard box is a lovely plastic bag which contains everything we'll need to screen ourselves for colon cancer. And in opening this up, the very first thing you come into contact with is the lovely patient guide, which contains all of these step-by-step instructions for collection and sending off, as well as who Cologuard is meant for and who it's not meant for. For everyone out there, it's for patients with an average risk for colon cancer, not those with a strong family history or irritable bowel disease or ulcerative colitis or any of those other conditions which could give you some atypical results. As well as instructions on how to return your kit, because it doesn't matter if you've collected it if you don't send it in.
That is true. That is true.
All right.
All right.
All
right, so let's see. So then the next part is going to be the device that you place under your seat, and conveniently it says place under seat. So that's pretty good. That goes on your toilet to help with collection.
Which this is what should be sitting in the bracket, which is your actual stool sample collection container. So as you can see, it has a very
much better.
sturdy lid, and that sits in your toilet to collect the actual sample. And we'll leave this off for the time being. But in addition to that, we have the lovely little tube, which you can see here, is meant to collect the stool from your sample. And along with that, on the wand, you'll see some little tiny grooves, which are meant to just gently scrape the surface of your sample, and goes back into the tube, which is filled with preservative fluid in order to send that back to the lab. And then the last thing in our box here is a lovely larger bottle of preservator, a lovely larger bottle of preservative. So this is meant to go into your bucket there to preserve your sample, after which you would then place the collection container top, not crooked like I'm doing it, but tight.
Looks pretty straight. Good.
So that it's all together. And after you've collected everything, this goes back in the box from whence it came and gets shipped off via UPS to the testing facility.
It's as simple as that. It's pretty simple.
Yeah. And the beauty of this style of screening is that you don't have to do any long drawn out preparation in an attempt to collect your sample. You can do it at home in the comfort of your own surroundings. And if it's positive, however, you will need to follow up with a gastroenterologist to do a regular colonoscopy to figure out if there is anything going on in your GI tract there. If you're terrified of the preparation for a colonoscopy or just don't love the idea of being put in a little twilight sleep, this is a very good option for ruling out a very serious cancer and an easy one for all of us to do at home.